Welcome to the Learnskin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Our skin is our first line of defense, our largest organ, and a major component of our physical identity.
It plays an important role in our health, psychology, and how we connect and relate with those around us.
So join us as we delve into the art and science of skin health in today's episode. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists.
Yes, we are.
This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learn Health, Inc. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional.
Absolutely not.
This podcast does not constitute medical or professional advice or services. If you have a medical concern, please consult with your physician. Welcome, everyone, to the Learnskin podcast. Today, I'm flying solo, so Dr. Hadar is not with me, so we're not going to do our what's up routine today, but nevertheless, I can ask myself what's up, and I'll say, what's up, Raja? How you doing? And today, we are going to be talking to a naturopathic doctor about the treatment of PCOS and diagnosis approach. And would love to welcome you to the podcast, Lauren. And this is Dr. Lauren Vreeland, and she's a naturopathic doctor. She has previously trained at Bastyr University. She's been a good friend of mine for a while now, and she does have a focus on dermatology and women's health. So welcome to the podcast.
Thank you so much, Raja, for having me.
Yeah, it's pretty exciting to talk to you about this because I know that we've been wanting to do a podcast for a while with you, and it's pretty great to get you on finally. Can you give us a little background to your training and your clinic in general? So kind of set the stage for what we're going to be talking about.
Yeah, absolutely. I did my undergrad in biochemistry at University of California, San Diego, and then was up at Bastyr University in Seattle for my naturopathic medical program, and was starting to pursue additional training in dermatology and women's health while I was still in school, and then moved back down to Southern California, where I'm from, and began practicing in a private practice in 2011 as a naturopathic doctor. And I've been at the same practice from the beginning, and it's outpatient primary care type of setting, general naturopathic practice, and I do focus on women's health, dermatology, as well as allergies and autoimmune.
That's great. And then in terms of your patient mix, how many of them come in for women's health specific concerns? And of those, do you end up talking about skin concerns quite frequently?
Definitely. It's quite a mixed bag with naturopathic patients because they're going to come in and usually they're presenting with more than one complaint. And because we're looking at the whole picture, they often have a list that may have some common threads and themes, for example, that would tie back to a condition like PCOS, but they might present and just have on their list acne and weight gain and hormonal imbalance or suspected hormonal imbalance. And we have quite a range of patients that either come without any diagnoses, without any formal diagnoses, or that have already been to multiple specialists and are coming with their list of diagnoses that they've already been given or evaluated for. And that it's, in terms of percentage, I would say it's at least 75% women that I see in my practice for a range of things that they're coming in presenting for, but definitely high population of females in the practice.
Yeah, when you said, oh, I have acne, I have weight gain, suspected hormonal imbalances, maybe that's a great segue into PCOS in general. And by PCOS, for anyone that's not familiar with the term polycystic ovarian syndrome, there are some clear diagnostic criteria, but can you talk to us about when a patient comes in and they're thinking, or you're thinking they have PCOS, what is their most common complaint that they're coming in for? What is their concern before you start thinking, hey, this patient might have PCOS?
Mm-hmm. So acne is common. And of course, with dermatologists and you and your experience in dermatology, I'm sure you experience patients coming in and their skin is something they see that other people see. So right away, it can be troublesome and interfere with their daily life and activities. So skin, I think, is a big motivating factor for people to get in and see change there, weight gain. And then the irregular menstrual cycles, that is not uncommon. I don't know that it is as motivating per se as the skin lesions or the weight changes, or difficulty losing weight. But those are common presentations that I see. And in terms of the criteria, I'm always keeping in mind that PCOS, it just requires the 2 out of 3 criteria for diagnosis. So that could be oligomenorrhea is one of the 3, hyperandrogenism signs is 2 out of 3, and then polycystic ovaries on ultrasound. And I have had patients come in and they've been told recently by a gynecologist or maybe endocrinologist that they don't in fact have polycystic ovarian syndrome because they had an ultrasound and it didn't show polycystic ovaries, but they still have the other 2 criteria. And it's helpful, I think, just to remember that it doesn't require the imaging to get the diagnosis, because some patients, I think, that need to be treated for PCOS are getting told that that's not what it is, and then they are off looking for answers elsewhere.
Yeah, there are common myths with PCOS, isn't there? Maybe this is a good opportunity to explore some of the common myths, but I think your point raises a good one, which is you can't just go off of imaging to make the diagnosis. And Lauren, I don't know if this has come up with your patients, but another common myth that comes up is that patients with PCOS can't have kids. And that's just not true. I've seen many patients that have PCOS that do end up having children. And so, you can't go with that as a diagnostic criteria either.
Exactly. And I think it's great to remember that and reassure the patients, because I've definitely had women come in and they get sent home with the diagnosis of PCOS and not much else in terms of information. And they are an emotional wreck because they think, man, I'm going to have fertility issues or ongoing problems, or I'm definitely going to develop diabetes or cardiovascular issues. And there's quite a range and spectrum that I see with PCOS. And I think the education piece is so helpful for giving patients that time and explanation of what it does mean and what it doesn't mean, or things that might be correlations or associations, but aren't a guarantee that they're going to develop that or have that problem.
No question. I think these are all such really important points, because patients with PCOS, they are at elevated risk for having hormonal imbalances, insulin, hypersensitivity. They are at elevated risk for all these things. How do you approach counseling when you talk to a patient with PCOS? And I know we're going to talk about other factors that might increase your risk for developing PCOS, but when you have a patient in front of you with PCOS, clearly their skin issues are going to be a big one, acne and extra hair growth, or even alopecia that comes with the early alopecia, the androgenic alopecia variant.
Right.
How do you approach counseling from a lifestyle perspective or a dietary perspective? What are some of the things that you take into account when you're talking to someone?
It's a great question. From a counseling standpoint, I think there's a couple points. One is that it reminded me, as you brought that up, that women with PCOS have an increased risk of depression and anxiety. So it's, another reason that it's important to spend a little time talking through that with them and then evaluating for that comorbidity. And then for counseling on lifestyle diet, it's critical to remember, understand how PCOS, some of the pathophysiology. So it's completely associated with insulin resistance. And that's true even for women who do not have the weight gain or overweight or obesity picture in their presentation. We still see that their PCOS symptoms respond to lowering insulin and treating insulin resistance. So the kind of science behind that, the hyperinsulinemia will enhance the production of androgens by the theca cells in the ovaries, and that will lower sex hormone binding globulin and thus increase the free testosterone level. So the way that insulin and testosterone are correlated, I think it's just so helpful to remember that point and how the impact on the ovaries, and thus leading to diet and lifestyle recommendations. Everything starts with decreasing the glycemic load and improving insulin resistance. And so that's usually going to look like regular exercise, especially muscle building type of exercises or high intensity intervals, have been
Mhm.
shown to be effective at improving insulin resistance.
Lauren, can I ask you a question right there? What is there a reason you favor muscle building exercises in particular?
For PCOS,
Yeah, because you mentioned muscle building, so I'm curious.
yeah,
Is there a reason that you do
so
that?
we know that muscle cells are more sensitive to insulin. So the more muscle that we build in the exercises, the more improvements we'll see in decreasing glucose and improving insulin sensitivity. Not to say that restorative exercises and other types of exercise are not also helpful for so many other reasons, but there are a few studies, at least that I'm aware of, that specifically support the interval training or that kind of fast twitch muscle building to improve insulin resistance.
So some sort of it sounds like some sort of resistance training, interval training that's really going to stimulate muscle growth.
Mm-hmm.
Part of the plan.
Yep. And then the diet usually is going to include carb restriction of some sort. And again, the template would be a whole foods based, colorful diet with plenty of fiber, because we know increasing fiber can stabilize blood sugar and improve insulin sensitivity. But there's a variety of diets out there that I think can depend or be individualized patient to patient. I'll tend to use a Mediterranean paleo type template, or if it's a patient who prefers to a vegan diet, then I just want to make sure that they are seeing that they're getting not too many processed carbs and not too many refined sugars.
Yeah, it's so easy to do that, isn't it? In a vegan diet, if you don't watch it,
Happen.
a ton of processed carbs and
Yeah.
definitely a ton of refined sugars.
Yeah. I was just doing a little bit of update on my research with preparing the lecture for the IDS conference on acne and diet. And it made me think about how I often have patients come in and they report developing acne or their acne flaring after going on a vegan diet. So just an interesting side note. I'm looking at exploring a little bit more what that might be caused by, but I think sometimes it could be the higher carb intake that's possible if you're not eating, if you're not choosing vegetables and whole foods on a vegan diet.
Yeah, and you're referring to the Integrative Dermatology Symposium. And yes, Lauren, we are so excited. You're going to be talking and giving us your pearls and tidbits on acne. And we're going to get a tiny innuendo and window into that here today, but I know that you're going to give us.
Everyone should come in integrative terminology.
And you're going to be on the panel too, which is always really fun with the integrative panels when we're talking about acne. But to go back to PCOS, before we jump into, and I would love to hear about, what are some of the regimens that you use when it comes to treatments, either botanical or herbal, or just what are specific foods that you like? I know you've mentioned some already. But before we get into that, can we talk about the etiology of PCOS? Because you mentioned a few things that maybe we don't think about that may also be contributing factors to why people develop PCOS. Could you talk a little bit about that?
Sure. It's always, to me, very fascinating when we look at the research that is there on how PCOS develops or what are some of the contributing factors. And just in general, we know a lot of endocrine disorders, obesity, cardiometabolic syndrome, that a lot of that's being impacted by our genes and the way the epigenetics are affecting our gene transcription and expression. And that isn't just in our lifespan once we're out of the womb. It starts even before, when we're in the womb, or even before the egg and sperm are even fertilized. So there's effects that are multi-generational from environmental factors that we're seeing. And so for PCOS specifically, some of the contributing factors we know are BPA exposure and phthalates, so plasticizers, plastics, methylparaben, triclosan, and the studies show that the exposure to those chemicals perinatally or in the womb are impacting females' risk of developing PCOS later in life. And there's also associations showing an elevated AMH in pregnancy, which an elevated AMH often is a association or correlation for women with PCOS. They'll tend to have an elevated AMH or can tend to have an elevated AMH. And so that elevated AMH in pregnancy in that mom can impact her future child's risk of developing PCOS. And I don't know that there's studies that show the lowering of the AMH or the treatment and management of PCOS prior to pregnancy necessarily lowering that risk, but hopefully we could have studies that would elucidate that more, because that would give us as clinicians just more, encouragement to really make sure we're treating women with PCOS, not just once they're pregnant or when they want to get pregnant, but, before their childbearing years, to make sure wherever we can lower the risk for their future children, that we are counseling them on decreasing plastics, and not just women with PCOS, but all women, especially that are going to be bearing children, that they can decrease their exposure to these plastics and chemicals that we know have endocrine disrupting impact.
This is a very interesting point, because there was a study that came out of Turkey not too long ago. It was June of last year, where they published online, and I think the full publication came out in 2019. I mean, in December. But they looked at 62 girls with PCOS, and when I say girls, they were aged 12 to 18, and they matched them to controls, and they looked at BPA levels, bisphenol A. And they looked at the BPA levels, and they were elevated in those adolescents that had PCOS. And apparently, it was almost double the level of those that were controls. I'm just curious, when you're talking about exposure to plastics and whatnot, when it comes to BPA, there are some common sources of exposure, aren't there, for
Absolutely.
BPA?
Yeah.
And, do you have a conversation around that? And because I know, one of the areas that's been a big controversy has been water bottles. And
Right.
are there certain water bottles that might leach BPA, or are there certain plastics? How do you approach those sorts of conversations?
Yeah, it's tough because more and more we're surrounded by chemical pollutants, and we want to be able to, or at least this is maybe my personal approach, I want patients to feel like they have freedom, and not that everywhere they turn, they're going to be bombarded by, something that's causing cancer or PCOS or, whatever it may be. But with the information we have, I try to give patients kind of a guideline of places to start looking for some of the changes they can make. Maybe they do it. Some people are all or nothing, so they want to just throw out everything and start new. Thankfully, there's more awareness, I think, around plastics and pesticides and the impact on health. But there's definitely patients that still come in that maybe are using makeup or skincare products that have some of the plastics or phthalates in them and don't know it. So I have a home health toxin checklist that I'll usually try to provide for patients, so that they have a starting point of things to be even looking for. And that would be replacing plastic Tupperware or plastic water bottles with glass or stainless steel. And the labeling, you can find a lot of plastics that say BPA free now, but that doesn't necessarily mean they're better, because the BPB or whatever other substitute that's being used probably has just as much, if not more, detriment to the endocrine system. But I think besides plastics, receipts are a high source of BPA, and that's one that's important for especially certain occupations where they may be handling a lot of receipts, or paper, BPA paper. And the skincare for women is a big one too, that they are aware of what types of products they're using, both in skincare routines and in makeup or perfumes or fragrances.
Well, Lauren, this is pretty interesting because, and I mentioned one study, but there are multiple studies that looked at BPA just to offer some balance. It's very hard to prove a causation. So, it hasn't been proven that BPA is a causation of PCOS.
Mhm.
I've seen, multiple studies where there's been an association, but it is
Yeah,
one of these
heavy
things where,
correlations.
yeah, there have been some correlations even to the hormone levels, like you're mentioning. I mean, there have been
Mhm.
correlations that have correlated BPA levels to the testosterone levels in the bloodstream and whatnot.
Right.
And I think it comes down as clinicians where we just try to make a reasonable have a reasonable conversation. We say, okay, yes, it's not a causation, but at some point, maybe just try to live a healthier lifestyle. What do you say to people that need to drink a lot of water throughout the day or whatnot? Do you try to move them towards having a non-plastic water container? Because now I see a lot of people carrying around water bottles that are not plastic, but metal water bottles or other sorts of water bottles that are reusable. What's your take on those reusable water bottles, or what are some of the lifestyle choices you tell people to do to try to reduce their exposure?
Yeah, so that would be on my home health toxin checklist would include the.
Oh, you have that in there too. Looks like we need to get that checklist linked to
Yeah,
this
I'll send it
podcast.
again. I will send it again. Make sure you get it. But I mentioned in there just replacing plastic water bottles with reusable water bottles and plastic Tupperware with glass. Or I use mason jars a lot for storing food. And
Really? Yeah,
actually
that's
got
a good point.
reprimanded by my son's preschool, that he wasn't allowed to have glass in his lunch pail. So I was like, oh, that makes sense. It's kids on a playground. So I had to replace the mason jars with a cute little stainless steel, set. But I mean, in terms of, I think the information and resources we have available currently, stainless steel water bottle, there's a lot of good brands out there, or definitely avoiding plastic water bottles that, one, are sitting in cars or in the hot sun and leaching plastics, and two, are just not as environmentally friendly because they're getting tossed into recycling bins or maybe the ocean. So the stainless steel is what I tend to do for water bottles, and then for cookware, stainless steel or ceramic coated cast iron or just cast iron, and then the glass Tupperware.
Now, when it comes to treatment, what is your approach? Besides, we've talked a few things that you can do from adjusting habits and whatnot. Are there particular botanicals or herbs that you like to incorporate, or what is your approach to treatment?
There are, and the top two or three, I guess I'll give, are inositol. And inositol is well studied in being used for PCOS or hyperandrogenism. It's great because it influences both the hormone levels but also the insulin resistance. So it can improve insulin sensitivity. It can help to regulate cycle length. And the other potential benefit is it can have a little bit of a mood enhancing effect. And so that can help with the anxiety, depression. And the so that's inositol. NAC, or N-acetylcysteine, is another well-studied nutrient. It's made of cysteine, the amino acid, and N-acetylcysteine is a precursor to make more glutathione. So that's just a nice antioxidant impact. But in terms of the studies on NAC and PCOS, it, again, similar to inositol, improves insulin sensitivity and menstrual regularity, and it can lower hormones as well as improve the hirsutism, or male pattern hair growth. And the dosing on NAC, I think the study showed 600 milligrams 3 times a day to work. I usually use a 900 milligram and just have women take 2 of those a day. And I'll do that in combination with the inositol. So that's kind of my right out the gate duo that most of my patients with PCOS are going to be prescribed. And then berberine is a wonderful herb that can improve insulin resistance. So I'll use berberine in metabolic syndrome patients with or without PCOS, but in PCOS, it also has been shown to improve menstrual regularity and rates of ovulation, and can improve blood sugar and cholesterol markers. And I'll usually dose that at 500 milligrams twice a day. I think the studies showed 400 milligrams 3 times a day, or one study showed that on the Berberine. And most of the studies tend to land somewhere in that 1,000 milligram range per day. Those are probably the top 3 supplements. There's some other good research, and I would say Dr. Tori Hudson, I'm a big fan of her updates on her blog and research, and she'll include information about different herbs and their improvement on fertility rates. Some of those studies are particular to women with PCOS and how to improve ovulation and our fertility rates, or even things that can supplementally help with women who might be going through Clomid or fertility treatments. Things like mushroom, melatonin has been studied. Sorry to interrupt you.
Oh, no, please go ahead. I was just going to jump in and say Berberine is one that, we've been thinking about for acne in general too. So, it's interesting when you talk about Berberine for insulin resistance. Yeah. And I believe actually there was a meta-analysis that was done where they looked at Berberine. I think they looked at like 9 randomized controlled trials, and they found that Berberine metformin were not significantly different in alleviating insulin resistance. So it's interesting that you incorporate that into your treatment.
Yeah, and the Berberine, I didn't even mention that part of it, is it's an antimicrobial. So there's other benefits to it of improving the gut microbiome. And that is a whole nother subject, but the influence of the gut microbiome on hormones and...
I have to have you back, Lauren. Sounds like we need a part 2 to this.
So, and then black cohosh is another herb that has been shown in research to induce ovulation. So that will sometimes get used for my patients who are getting ready to try and conceive, or are looking at fertility, or maybe they've, already tried for a certain number of months, and I'll add black cohosh into their regimen before, not during pregnancy, but before, to try and help the ovulation and improvement in fertility rates.
Wow, this is a rich set of both treatment plan pearls and lifestyle pearls. Lauren, how do you connect with other practitioners? So, there's so many patients going to different sorts of practitioners, and just thinking about the integrative model, how do you communicate and work out a plan when you're having patients that are traveling between practitioners?
That's a great question, and something that I'm so thankful for how Learnskin has provided a nice platform for practitioners to connect. And I do my best to just be available and make phone calls to connect with practitioners. But as probably most practitioners, I'm also really busy, and I wish I could have those conversations, for all my patients to collaborate care. But when it's not possible, I just try to make treatment plans that are kind of streamlining the information, and then let them know, like, I'm happy to speak with their other practitioners if they have any questions, or reach out if especially if I'm changing anything, like if they're on metformin or spironolactone and we're gonna change that, take them off of it. I'll try to update the prescribing doctor and make sure that they're in the loop, or that we're on the same page. But it's difficult. I would say it is one of the more difficult parts of practice in an integrative approach, or, in a private practice where I'm not working alongside, in like a hospital setting, the other specialists or practitioners that might be part of the patient care team. So just having the conversations, being available, providing the treatment plans so that the patient can present that for the other practitioners. And then networking. I am looking forward to more networking again at any of the events happening with Learnskin.
Yeah, well, it sounds pretty awesome what you're doing, Lauren, and we appreciate your time. How can people connect with you? Say they want to come see you. What's the best way for people to find you, either online, social media, or, if they want to just show up at your address? Probably they need an appointment though. So let's not promote that. But, how do people find you?
Sure. So I have a website, and it's drlaurenvreeland.com. And that's DrLaurenVreeland.com. And I have an Instagram at Dr. Lauren Vreeland as well. I am guilty of not being on social media much, partly because of raising 2 little kids right now. And
you have a life, Lauren. You have a life.
But I do occasionally post on Instagram and then the website. And there are phone numbers on the website to reach out to I actually am out of 2 different offices, but mainly out of Costa Mesa, California. And the contact info is there.
Well, we appreciate your time today, and we look forward to the many lectures that we hope to hear from you in the future, and perhaps even more podcasts in the future too. Thanks, Lauren.
Fun. Thanks, Raja.
Thank you for tuning in to today's episode with Dr. Raja and me, Dr. Hadar. This podcast is brought to you by Learnskin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs or subscribe to the podcast today and never miss an episode. Have a great day and stay curious.